Hari Om, Namaskaram to all of you.
Hari Om, sir.
Hari Om. So welcome all of you for this webinar on the yoga therapy courses. So these are courses we usually conduct at regular frequency. So what we want to know, our teachers will be coming and explaining about each and every therapy courses. So before getting into that, it is better to know from where we are studying. So we'll spend few minutes to know about our ashram, SDYV Yoga Vidyalaya. I'll share few slides. So this is the lineage of our gurus. We have three photos above: Swami Shivananda, Swami Satyananda, and Swami Niranjananda Saraswati. So they are great gurus. Most of us will be knowing them. We have Swami Satyananda in the middle, who is the disciple of Swami Shivananda. And we have Swami Niranjananda, who is the disciple of Swami Satyananda and heading the BR School of Yoga now. And we have two Swamijis on the below, who are the direct disciples of Swami Satyananda Saraswati, who is the founder of BR School of Yoga. So we have our Swamijis, Swami Vajrapani and Swami Gambirananda, who are our Swamijis at SDYV Yoga Vidyalaya, who are the direct disciples of Swami Satyananda Saraswati, the founder of BR School of Yoga. Swami Vajrapani is the founder, and Swami Gambirananda is the Acharya, and who is responsible for all the activities in the ashram, what we are doing. You can see here, it's very difficult to have somebody from tradition, from a Guru Shishya tradition. So here we are so fortunate, like we have our Swamijis who have come from the tradition of BR School of Yoga directly from Swami Satyananda Saraswati. We have our ashram in Chennai. You can go through our website, shivadarshan.org. We have a good area of ground and first floor where we conduct many offline classes and many functions at regular intervals. You are welcome to visit our ashram. So there are everyday classes going on, fitness classes, therapy classes, and all those things. And many therapy classes are taken by our Swamiji directly. So our Swamiji is having immense experience, not only in spiritual dimension, but also much bigger knowledge in yoga therapy. So if you have someone who want to learn directly, or if you may be a yoga teacher, but if you want to undergo some kind of therapy, you can come and directly get the therapeutic treatment from our Swamijis. So if you want to see our SDYV Yoga Vidyalaya, it's run by senior most Swamijis who are from BR School of Yoga. It's 100% charitable trust. Remember, this is not a yoga studio or center where the profit is the only motive. Whatever courses you are joining, if you see the fees alone, it will be like not even 20% of whatever available outside. So it's 100% charitable trust. We run by donation. So all the thing we take as donation. With that money, we run the entire institution. This was founded in 1992 by Swami Vajrapani Saraswati, whom we have seen, the senior most Swamijis. The new building where we are in, of course, this building is again decades old. Where we are in was inaugurated by Swami Niranjananda Saraswati of BR School of Yoga. And by our Swami Gambirananda Saraswati, who is Acharya, by Swamiji's tireless effort, we got the recognition from DSIR, Department of Scientific and Industrial Research from Government of India. That means we regularly do yoga therapy research and we submit our papers to Government of India, which keep on renewing our recognition. And both of our Swamijis were awarded as Golden Swamiji, the title of Golden Swamiji, because of their long time service in yoga and in BR School of Yoga. So now we are in the 34th year. The institution is 34 years old. You know, the moment time Swamiji started this institution, there were literally no institution in Chennai around. So now due to Corona and online, we are fortunate, like we get contacts from many traditional institutes through which we are also reaching people. But we are very proud to say, like, our institution is around 34 years old. Now, there are many courses we take. There are 4 flagship courses: TTC1, TTC2, Kids Yoga TTC, and TTC3. These 4 courses usually happens twice a year. Nowadays, it happens 1 to twice a year based on the time and schedule. What we are going to start now is TTC1 and TTC2. TTC is Teacher Training Course 1, Teacher Training Course 2. You can see in the course 1, we cover about high blood pressure, diabetes, asthma, and spondylitis. In course 2, we cover menstrual disorders, thyroid, PCOD, prolapse, and menopause. So you are going to see our teachers who are going to cover this TTC1 and 2, little, kind of a glimpse into it. What is that we are going to cover? And we have other courses like Nadi Shodhana Pranayama courses, which is running now. And there are courses which Swamiji takes directly, which are Chakra Awareness Program. We have Manipur Chakra course. We have Mudra for Yoga Therapy, Anatomy Physiology, Patanjali Yoga Sutra. So many courses we take regularly on it. So we'll come back again in the end. I'll be coming back and concluding what is that speciality of TTC1 and TTC2. To have a kind of a summary, all these courses are designed by our Swamiji long time back. We started this TTC decades back. And all the teachers are trained and selected by Swamijis. You know, people who may be interested, if they want to teach, it's not like in our ashram, simply they give. Our Swamiji will handpick them. The course happens under direct supervision of Swamijis. Though Swamiji is not taking any subjects now, but with Swamiji's blessings, everything happens. And we also get a few doctor sessions. See, because when you have knowledge about both allopathy point of view and yoga point of view, it will be more better. And most of our doctors are spiritually oriented, very good yogic knowledge. So you will expect some lectures from them. You also get some live projects, either in Yoga Nidra or high blood pressure. Means Yoga Nidra for TTC2 and high blood pressure for TTC1. The project, you will be guided through the project so that when you finish this TTC course, you will have some kind of hands-on experience. You will get a lot of confidence on it. You have Viva, you have kind of a objective exam, long answer exam. So this is a kind of a very challenging course where you need to spend at least 1 or 2 hours a day to study. And once you finish, successfully pass, you become alumni of the group. That means you can be in touch with teachers and Swamijis and ashram activities. You can take help of Swamiji anytime. You can call Swamiji, you can come and meet Swamiji, take any kind of guidance for your therapeutic this thing and spiritual dimension. And that will be lifetime access. And if you are capable of teaching, then Swamiji can give opportunity to teach you. If you want to volunteer any activities, you are very, very welcome to do it. You will be learning Yoga Nidra and meditation, both the teacher training course, any of our course. If you join the teacher training course, Yoga Nidra and meditation are compulsory courses because these two you can give to anyone. Somebody may not be able to do asana pranayama, but they can do Yoga Nidra and meditation. This is part of our course. These are some pictures like you can see Swami Chidanandaji Maharaj visited our ashram long time back. Here you can see Swami Nirajananda Saraswati. You can hear Swamijis from our Kanji Kamakoti Mutt. And we also have a much bigger facility at Tiruvannamalai Ashram where we conduct bigger sessions. So we'll be taking the people who joining here once to Tiruvannamalai Ashram. So we welcome all of you to join this and make use of it because this is one of the very few institutes taking this kind of therapy courses, which we found very useful. When I also came here for the first time, I found it was immensely useful and very intense program for 3 to 4 months. Hari Om. Thank you. I request the respective teachers, Rashmiji, to take the next session regarding TTC1.
Hari Om, everybody. Welcome to the webinar. So now we will be seeing why we have to.
Jai, put a play area. Jai.
I am audible, right? I have to send a PPT sharing.
Yeah, you can share now. You can share.
Okay. So now it is clear, right? PPT? Yes, okay. So
Yes,
now,
ma'am. We can
yeah.
see your PPT. I can see your PPT.
So now we will see what we will be learning in high BP codes and diabetes mellitus. So now, So first we have to know what exactly the health means. So health, according to the World Health Organization, it is a state of complete physical, mental, social well-being, not merely absence of disease or any infirmity. And according to Ayurveda, the same thing, balance of dosha, agni, dhatus and malas along a content, peaceful mind and spirit. So from Ayurveda health definition, World Health Organization has taken the definition for health. So both these systems or the frameworks are saying the same. It is not just absence of disease, it is the complete well-being, inclusive of everything, physical, mental and social. Okay, so healthy body, healthy mind will give you a happy life. So the first thing, whenever you go to a doctor for any consultation or any disease if you have, and if you go to the doctor, what is the first thing they do in the hospital? You will not even meet the doctor. You will be waiting only. In that meantime, what is the first thing they do to you? Yes, Lavanya ji?
Details, patient's name, age, all that.
Yes, that you will fill it and you will give in the register. After that, what is the diagnosis they do?
Okay, if they will start saying that any history is available, history of the patient, they will talk to the patient to analyze what is the problem actually.
Yes, no, diagnosis. First diagnosis, what they do? They are taking the...
Blood test.
Whether we have constipation.
Oh, is that so? This is new to me. So wherever I went or most of the people whom I see, they take BP first. Is that right?
They will check BP first.
Yes, BP and temperature.
Yes, BP and temperature. This is what I encountered. I don't know. Maybe in some other cases it is different. But this is how I felt and I observed in the hospital. Whenever we go, immediately they take the temperature. They will have this shooting gun like a thing. They do the temperature thing. Then they will take oxygen after corona and then BP. So BP is the first thing they check in the hospital. And then this BP will actually reveal the immediate state of cardiovascular system. Okay, and with that they will see if anything else is there or not. Then blood pressure is not just a number, it is a window into the body's homeostasis balance. So very important, the internal situation or any functioning of the body must have a balance. If there is a imbalance, then this will lead to a disease. So this BP will first tell you, is there any problem in the balance in your system? So every disease has its own limitations. Only a therapist will know the solution. That is why we are supposed to learn a therapy course from a recognized institution, from a proper guidance of a teacher. Okay, so what is that? Do you know that we cannot give more than 90% of asanas to a high BP patient? So whatever you have learned as an asana, you might have learned in many places, many asanas would have been taught to you. But do you know you cannot give 90% of them to a high BP patient?
Yes.
Yes, that is good. If you know, that is good. If you don't know, you have to learn it. Okay, so... And then for pancreas, you have to activate, for diabetes, you have to activate the pancreas. For activating pancreas, certain set of asanas are there, certain set of pranayamas are there. And in Yoga Nidra, we can modify the part in the Yoga Nidra and you can give according to a diabetic patient. So this therapy is one-on-one. It is not for a group or like common yoga classes they conduct. It is not like that. So it must be one-on-one therapy, for which we have to know many things. So what is that a therapist must know before conducting a yoga session? So the first one is anatomy and physiology. Each and every disease is connected with an organ. So we have to know anatomy and physiology of that organ. In total, the whole system, whole body system anatomy, you must be knowing. Then symptom and management. As already said, each disease will have a specific symptom. You must know what is the disease behind the symptom. Then therapeutics. So this therapeutics is medication we cannot give, but what is that we can give in yoga? We can give asana and pranayama according to the disease. Then what is, and very, very important, more than what is to be given, you must know what must not be given to that specific care seeker. Okay. So for that, a proper learning is very important. Then dietary guidelines. Anyway, you have to know, because most of these things, high BP, diabetes, asthma, everything is related to your lifestyle. And these are coming under lifestyle disorder also, for which the basic thing where you have to change is the food. So dietary guidelines is very important. A therapist must know. Then understanding blood pressure. So what is exactly blood pressure mean? It is a force exerted by circulating blood in the artery walls. Okay, then the heart acts as a body's central pump, generating this pressure with every beat. So that is called, that we call it as lap-up. And then a continuous shift away from the normal, whether upward or downward, that is high or low, will indicate the cardiovascular system is not functioning properly. So normal BP nowadays they say it is 120/80. When you come to the class, you will be knowing what is 120, what is 80, why it is said like that. Then low BP, it is less than 90/60, and high BP is more than 140 and 90. So what exactly cardiovascular system have? It has a heart, it is the central pump. It drives oxygenated blood throughout the body with rhythmic contractions. Then artery, it carries the oxygenated blood from the heart to other parts of the body. Then veins, they are carrying deoxygenated blood from other parts of the body to the heart. Then we have the blood. That is the transport medium that is going to take each and every nutrient, and then it is going to circulate it to all other parts of the body. Then there comes the nervous system. So nervous system is divided into central nervous system, peripheral nervous system. Peripheral nervous system, again, it is getting classified into somatic and autonomous. Somatic we are not going to see. We will see autonomous nervous system. So this is regulating the involuntary functions. In that we have sympathetic nervous system and parasympathetic nervous system. So these two, if they are in balance, then homeostasis is maintained. Then, so what exactly yoga and exercise? What is the difference? The stress connection. So the first one is chronic stress is recognized as the root cause of all modern lifestyle diseases, including hypertension and diabetes. Then, unlike any exercise, what they do in gym or any exercises like Zumba or anything, whichever may be, other than yoga, it activates the sympathetic nervous system. But yoga, it will integrate action with the deep structured relaxation. And it will restore a balance between parasympathetic and sympathetic nervous system. So here, so this exercise will activate fight or flight symptom, that is sympathetic nervous system. So there is physical exertion and there is no relaxation phase as such. After going to gym, they will come home, take a bath and go for their office or do their daily routine. But here in yoga, we start with physical activity, asana, then we move into the breath, then we move into the mind. So all three levels are being taken care of, and at the end, relaxation is also given. So yoga is not just movement, it is a medicine for autonomous nervous system. So now hypertension, if someone is having hypertension, what are all the organs that will be at the risk? So uncontrolled high blood pressure will affect the brain. So there can be stroke, hemorrhage, and then cognitive decline. Eyes, there can be retinopathy, then there can be vision loss also. Then heart, there is hypertrophy, that is pumping of heart will be more. Myocardial damage, the walls of the heart can get damaged. Then kidneys, it is nephroclerosis and chronic renal failure. Renal failure is kidney failure. Nephrosclerosis is the thickening of the walls of arteries in the kidney so that the circulation will be less and functioning of kidney will become low. Then what is this lifestyle, pancreas and metabolic disorder? So the lifestyle is the root cause for diabetes. Modern sedentary habits, chronic stress, poor dietary patterns are the primary drivers of the metabolic dysfunction, particularly affecting the pancreas. Then yoga will intervene the role of pancreas by improving the circulation, and also it will activate the vagus nerve, very important nerve that connects the stomach with the brain, and stomach is called the second brain. Nowadays, stomach is called the first brain. Brain is called the second brain because all the microbial activity that is in the gut, in total of the abdominal region, is what is controlling your personality. This is what they have found in the recent research. And then what is this pancreas about? The function, it has two functions. One is endocrine and exocrine. So endocrine, it is only 1% of the activity, but exocrine, it is 99% of the activity. Both these activities are balanced when you do your yoga practices. Then this Pavana Muktasana series, this is very important. This is the flagship thing, like, which is the foundational therapeutic toolkit. It was designed by Swami Satyanand Saraswati. So there is Pavana Muktasana series 1. It is anti-rheumatic, meaning the joints are all activated, and then it is safe for beginners, elderly, and any cardiovascular condition. We told you 90% of asanas are not given to high BP patients, but anybody who comes to you, you can start with this Pavana Muktasana series 1. It will not do any damage because it is incorporating your joint movements with your breath. And then this improves circulation and reduces joint stiffness. Then there is digestive and abdominal group. So the second one, it is Pavana Muktasana series 2. So here this is targeting your abdominal regions, then pancreatic function and digestive health is maintained. So the third set is Shakti Bandha Asanas. So here the energy blocks are removed from the body and the pranic flow is enhanced, and then the spinal flexibility is there and the metabolic process is very good. Now for this is just a guidelines, it is not in total. So the first, the asana approach, you will give Pavana Muktasana series 1, then the relaxation postures, then you will avoid inversions, strong forward bends and any breath retention. So the reason behind this avoidance will be taught in the class. Then about the pranayama, abdominal breathing, Brahmari and Nadi Shodhana, Shitali, Shitkari, then Chandra Vedana. It activates the parasympathetic nervous system, but just I am telling you this doesn't mean this is the sequence in which you are going to give. You have to learn what is the sequence. If at all you are going to give Chandra Vedana, you must know after that what you have to do to make them come out of it. Because just activating the parasympathetic alone will not be useful. They may become more relaxed and their activity may get reduced. So all these things must be known prior to you teaching to the care seeker. Then Ujjayi is very important for any kind of problem. Then when we come to diabetics, it is asana and cleansing because it comes to the stomach and abdominal region. Asana along with cleansing is very important. So the compression Pavana Muktasana series 2 and 3 is very important. And then Laghu Sankha Prakshalana will be taught to you in one of the classes, which is very important. You will experience first and then you can teach it to the care seekers, whoever comes to you. And then Pranayama, Kapalabhati and Bhastrika, abdominal breathing, Brahmari, Nadi Shodhana, Ujjayi, cooling Pranayama can be given. Very important, when there is a comorbidity of high BP and diabetes, you are not supposed to give Kapalabhati and Bhastrika. Not only this, asanas are also there when there is a comorbidity like high BP, diabetes and asthma, or high BP and asthma. There can be any combination. Some may be having all the three also. So if at all, if somebody comes like that, you must know what asana not to give, what pranayama not to give, rather than knowing what to give. Okay? Then, so all these things are related to lifestyle and it is related to food. So I am concluding my webinar with this slide. So today I have served you the appetizer. So the main entry is yet to come in the class if you join. Hari Om. Thank you. Namaskaram. So any doubts? Maybe at the end they will clarify the doubts for you. I think Vijay ma'am will be taking over. Thank you.
Ma'am, the presentation was superb. Hari Om.
Hari Om. Thank you.
The presentation is very good, madam.
Thank you. Thank you, sir. Okay.
Can we get the PPT?
Yes, sir.
Can we get the copy? Can we get the PPT? Can you pass on to us?
That I have to ask with the ashram people only.
I will ask Mr. Balamurali.
Yes, sir.
Thank you. Thank you.
Thank you.
Hari Om.
I'm speaking Hari Om.
Okay. Hari Om all. I'm here to
Hari
talk
Om.
about asthma and spondylitis. Okay. So let's start with asthma. Let me just mute. Okay. Yeah. All right. So asthma. Asthma, we all know it's related to the lung, right? It's a chronic lung disorder where people have trouble breathing. I think after COVID, I don't have to really explain the symptoms. People are familiar what happens when you're not able to breathe, right? So, what is the role of yoga in asthma or in treating asthma? So, asthma can be a combination of genetic factors as well as environmental factors. And we all know that how the environment is these days, pollution, right? And if you must know, 13 of the 20 most polluted cities are in India. The burden of asthma in Indian population is very, very high, and people are not getting proper treatment, and it is a huge burden. So how, not many people know, people in the middle class or upper class, they have the right treatment, but in the lower class people don't even know about the inhalers and so on. So what happens? See, the lungs, there is a lot of mucus because the kapha based or the mucus based asthma is the most prevalent. There is a lot of mucus in the lungs. Also, the airways, right? There is like a soft muscle. They also go into spasm. That is why they are not really able to breathe. And I think Rashmi ma'am already talked about some of the breath work, like relaxing and so on, right? Some of that will be taught in asthma as well. Why? Because we want to calm down the nervous system. When you're tensed, right? And if you're not able to settle down, that lasts longer. Imagine the same thing is happening inside of your lungs, in the airways, which will prevent you to taking the breath inside. So without breath, in the swimming class, usually they'll ask us to hold the breath for like 30 seconds to go underwater. How difficult it is for us. The same thing happens to asthmatics on a regular basis, especially during asthma attacks. So imagine their plight. They are mentally so stressed thinking about when they are going to have the next attack. And mentally also they become little weak because of that, because they cannot run like regular people, right? See, I'm talking about like moderate to severe asthmatics. Mild asthma, okay, they may be able to do the normal activities. Lot of asthmatics, when they have like wheezing, when they are not able to get enough oxygen, they become so tired. So they are tired, they are scared about the next attack. And then what happens? Their activity also reduces. Their digestive fire also reduces. When we catch a cold, we are not hungry much, right? We don't feel like eating. But this is the case for asthmatic because this is a chronic condition. So what we teach in this class is how to open up the airways in your lungs, right? So breath work, we already covered. And also the posture of the asthmatic itself changes because they are not able to breathe. They struggle, breathe like that. Their posture itself becomes like, the shoulder itself becomes curved. So we'll teach you the asanas that will correct the posture, open up the lungs, how to exercise all the intercostal muscles because they help you to breathe better, right? So we'll teach you the asanas to open up and also to strengthen the back. And Surya Namaskar again we'll be teaching because Surya Namaskar is so wonderful for most of the systems, whether it is reproductive, circulatory, or any system. It is respiratory. It is an excellent, and we'll teach it with mantras because mantras have their own benefits. Okay, so asanas, breath work, and how to relax. Some of it is like through the breath work, and some of it is through yoga nidra and meditation techniques, antarmona, all of that. Because sometimes the nervous system needs to be reset, and you have to understand why your nervous system is so tensed. And you can only know all about that when you go deep into meditation, when you calm your mind down and go into deep meditations. Then you will know, then you will start to understand, oh, I did this. And because even emotional triggers can cause asthma attack, not just the pollen in the air, your own, like, sadness, anger, they can also trigger. Fear can trigger. So you'll understand what is actually causing my symptoms. Because when you know, then you can avoid that to feel better, isn't it? So these are the different things. And then we'll also talk about how each breath work specifically like helps. Which breath work activates the vagus nerve, which one is like, calming the mind, balancing both hemispheres, and how it is beneficial with respect to like asthmatics and so on. Okay. So this is about asthma. Now let's talk about spondylosis. I don't have to tell, even small kids are having neck pain these days. It used to be like, like people in the middle age used to complain about neck pain, back pain, and all of that. But because of the mobile, and I think like, it's so difficult to control the children these days because both parents are working. Sometimes we want to have like quiet, we just give them the phone, even at an young age. And what happens? Even 8-year-olds are coming with the neck pain nowadays. But actually, spondylosis is like a degenerative disease, which we used to treat in the older population. But now it is becoming like, even we have started treating from the kids, like, under 10 also, they have started to have this problem. Another thing, the lumbar spondylitis. Cervical is primarily with the neck. When the nerves are compressed, you'll have symptoms in your shoulders, fingers. Sometimes you'll have like a tingling fingers, but the root cause may be a nerve compression in your neck. Okay? Because see, if you're carrying a lot of luggage someday, right, immediately we feel some back pain or something, or somebody lifts something and then the disc, it dislocates, or there can be a nerve impingement. See, all the nerves are coming out of the vertebrae in your back and the neck. And because of improper posture, there may be the nerve can get pinched, which will cause pain. So we'll be teaching asanas which will relieve the pressure in the joints. And then if there is any disc bulge, it will alleviate the pressure. We'll also strengthen the muscles that are surrounding the joints because all of them have to work together in order for you to perform your day-to-day activities properly, right? So in this case, we'll be teaching again, recent research says emotional pain and physical pain in the brain, they are executed in the same neural circuit. So sometimes you may have emotional pain, but the symptom could be physical pain. See, not everything is because of degenerative disc or the bones and all of that, right? Because in osteoarthritis, bone also gets degenerated. So not everything is because of that. Some of them are because of the emotional pain. See, that is why when we teach all the, meditation, yoga nidra, antarmona, you'll understand, oh, when I have this kind of emotions, my pain is increasing. How many of you noticed that? When you're having a bad day, is the pain more or less on that day? Yes? Yeah, more. So the emotional circuitry in the brain and the physical pain also. So that is why you need to treat as a whole, not like going to a specialist where the cardiologist just look at the heart, right? That will not work. See, you might get symptom relief, but then for the long term, complete, if you want to cure yourself of anything, you have to go to the root and understand. And how can you get to the root? If your mind is busy in day-to-day activities, you have to quieten the mind. See, that's the point of yoga, right? Chitta vritti nirodha, right? So we give the whole package so that you can understand the root cause. And I think Rashmi ma'am already talked about the contraindications. And if you have two conditions, what to do. And there are so many benefits of fasting, which we'll also talk about. The diet, what you must follow, like, for the different conditions, because everything plays a role in the condition. Okay. So we'll give the whole package, and there are so many people waiting, like, to be healed, and then otherwise they just go on medications for years and years. So if you want to treat any condition completely, yoga is the right way. I'm not saying we should not take medications. Initially we can integrate that as well, and slowly we can taper off, even people from chronic conditions, and slowly, like, I think the medicine needs to integrate yoga. A lot of people trust in medicine, but I think both need to work together slowly, like, eradicate the medications, like from the people, because there are so many, like side effects. But with yoga, when you understand the full picture, we can give them the complete permanent solution. Okay, so with that, I close my presentation because I think we have like back-to-back presentations. And thank you for joining. And so I think you probably are coming here to heal yourself, or you might want to heal others. Like, some people join the course if they have a particular condition, but some people want to help others. But believe me, there are so many people. And when we, whatever that we teach, right, they are not just for these conditions. Some of them will actually help them in other aspects of their life, even for their emotional well-being. See, which we didn't name them like, it's for like, anxiety or depression or anything like that. When we teach them, like, some of them, it's like overall well-being. Okay, so that's the beauty of this. Even though we may be giving some asanas, some breath work, it will actually heal several other conditions. Okay, thank you for joining. Vanishri? Do we have
Vijay ma'am, Hari Om.
Hari Om? Are we done with the presentation, or
Yeah. I think next is Shashireka ma'am. You're right.
Yes. So I'll be
Yes.
continuing with Ranjit sir. You had you wanted to tell something?
Nothing,
Yeah,
ma'am. Please
just to tell her that Vijay ma'am's presentation was superb.
Thank you. Hari Om.
Yeah, thank you. Hari Om all.
Ma'am, your presentation was very nice.
Wish you all Hari Om all. Wish you all a very good morning. Nice to see so many of you joining on a Sunday morning. Okay. So I will be talking about the yoga nidra and the meditation, which we will be covering as part of the TTC 1 and 2 courses here. Okay. Sir, could you share the PPT?
Yeah, sure, ma'am. Sure.
Okay. Okay. So the Ashtanga Yoga, the 8 limbs, all of you are definitely aware. So we are not going to discuss about it here. But as Vijay ma'am said, when we talk about a holistic aspect, okay, we start with the attitudes and we have to go deeper into the mind. So the of course the Yama Niyama, I think is the foundation for even taking up, even for any of you to join the course or do anything about yoga, that is already established. So asana, pranayama techniques, kriyas, all these will be covered in the respective subjects like the HPP or diabetes, whatever the disorders you're talking about, the respective practices will be covered in detail by those teachers, okay? Specific to the disorders. Some of them could be a combination as well. And as well as for the TTC2, the menstrual disorders, thyroid, all of that, the whatever the asana, pranayama practices and the kriyas, okay? So once we prepare that, okay, is that enough? No, we have to go deeper, right? So can you move to the slide? So all the disorders you have been listening to right now, are these only physical? No, right? So these are deep rooted. So these are all psychosomatic. So it's not enough just to address at the physical level or the symptomatic level. Of course, the medicines are needed. Whatever practices you follow here will be complementary to the doctor prescribed medications or prescriptions that you're already following. You will be going through that and you will be doing this additionally to complement the effects of that. Okay. So first we will be talking about Yoga Nidra. Okay. So what is Yoga Nidra? So in the current world, we all know the fast-paced life. Are we really relaxing? Or maybe I can put the question as, are we allowing ourselves to relax? Okay. So can you just move? So we are confusing the previous one. We are confusing relaxation with the sensory indulgences. No, so many are available today. I need not even name them. All of us know that, right? So the sensory diversions or the so-called entertainment, which modes which are available today, we confuse that with relaxation. We look forward. We go from 1 to 2 to 3. No, all the free hours we have. But still, at the end of that, are we feeling comfortable or calm? No. Because in a way, it diverts our mind, but it really doesn't help us to calm down or relax ourselves completely. So what is complete relaxation then? We know sleep gives us relaxation, right? But is it alone enough? May not be. Okay. Yeah, sir, you can move on. So may not be. We need relaxation at deeper levels, at the mental, psychological levels also. Okay. So Yoga Nidra is the solution which helps give a holistic relaxation. Okay. And why we need this? So there are different names by which it is addressed. Okay. The yogic sleep, the sleep of awakening, psychic sleep. Okay. Sleepless sleep, because it's not actually a sleep. It's a relaxation technique. Actually, the irony is we will ask you not to sleep during the practice. Okay. But that itself will lead to relaxation because it is a mode of rest which we will be taking with complete awareness. Okay, that is the main difference. During sleep, we are not aware. Even though the mind is functioning at a deeper level, the awareness is not there. So here, the Yoga Nidra is nothing but rest with in a complete state of awareness. We will be following the instructions. We know what we are doing. Okay. But the relaxation will happen. How? Because it is a very, very systematic technique. Sir, can you please move on? It's a very systematic technique. There are different steps. Okay. So the state of mind which we reach through Yoga Nidra, that is also called Yoga Nidra. Even the practice itself is also called Yoga Nidra. Okay. So there are multiple dimensions to the term Yoga Nidra itself. Okay. And this is the flagship technique of our Bihar School of Yoga. the lineage, no, you might have already heard about our gurus. Sir talked about already. So Satyananda ji was instrumental in introducing this practice of Yoga Nidra to the world. Okay. There were a lot of tantric practices at that time, but it was not accessible to the common man because all those needed deeper levels of intense practice and no, which everybody could not relate to. So he just took the essence out of those practices and put it in a simple way, which anyone can do at any time. Okay. And that is the practice of Yoga Nidra, which we will be going through in detail as part of the course. Yes, sir. So we prepare and go in steps. Okay. So for all these, we saw that we have asana pranayama practices. Okay. Sir, one back, can you go? One. Yeah. Okay. No, sorry, the same slide, but just the first 3 lines. Yeah. So even though we have asana pranayama practices, there are several sick or elderly people who may not be able to physically even do certain things, or who find it hard to work on their breath because they are already mentally disturbed. So that is where Yoga Nidra comes in. Okay, it is for all. Anyone can do at any time. Of course, like any other practice, not with the tummy full, because obviously we will tend to sleep. It can be done by anyone at any time and in any place. Okay, all you need is just a small place to either no lie down or just even you can sit and do. It offers relaxation at all levels, as I already said. So we can call it as a yogic tranquilizer. Okay. So there are different steps. We have to prepare first, and then we move on to relaxing, like allowing ourselves, our mind to get into the practice and preparing ourselves. And then it is nothing but a practice of complete awareness where we go layer by layer. We start with the body, move on to the breath, and go to the deeper levels of the mind. Yes, sir. Next one. So I would say that the Yoga Nidra practice, next one, sir. We can say it is like according to me, it's like a surprise gift. Okay, you get a gift. You expect something outside which is, you like. But what is there here, what you're seeing? Okay, maybe it is yourself, your transformed self. So the Yoga Nidra at the outset, though it appears just as a practice of relaxation, it has several deeper intent and the intention and different internal aspects to it. The secret of transformation, transforming your entire personality as we evolve through the practice and start working on the deeper levels of the mind. Okay, there are techniques available by which we can work deeply on transforming ourselves. So what you get out of the gift box is not just a gift or not just a complete relaxation, but it is a transformed you. And how we will do that, how we can work towards that, prepare ourselves and go on practicing, we will be talking in more detail as we go through the course. Okay. Yes, sir. Next. So the already Rashmi ji and Vijay ma'am talked about the psychosomatic aspects of all the diseases, right? For which a holistic, this one is required. So first is Yoga Nidra, where we prepare through relaxation. So in the Ashtanga Yoga, after Asana Pranayama, we have Pratyahara, right? So here, the practices which we give you as part of Yoga Nidra and meditation will start with Pratyahara, then move to Dharana and enabling one to prepare and go to the state of Dhyana. Okay. So Yoga Nidra, and then we have practices called Antarmauna, which starts with Pratyahara and moves towards Dhyanam. Then we have in the Shat Karmas, we have the Dharana practice of Trataka. All these we will be covering as part of the course. So what is meditation? I need not tell, all of you know why we need here. So as I said, our minds are all constantly moving outward, okay, always impinging from the external world. So where do I move away from there? Do I need a small space to just, stop all those external impingement on my mind and just allow it to be as it is, at least for a few moments daily? Okay, that is where meditation comes in. The external impingements we know is the cause of all the sorrow, unhappiness, the anger, discontentment we are facing today. So how do we step back from these? Okay, very simple. You're not, there is no uh, extra you have to spend or do something great. Okay, just a few moments of your time to move inward and spend time on yourself will start doing the magical effect. Yes, sir. Next one. So, what we do here is, and why? So already we talked about so many practices. Why I need meditation? Okay, because it's all about the mind. We know. Okay, even though we may be well, if our mind tells us you are not well, okay, won't we say I'm not well and no want to skip the class or anything that we want to do? Okay, won't we take it as a chance? Even though how many ever grown up a person may be, right? If we want to do something, if the mind decides, then there is nothing that can stop it, right? So it is important to start working on the mind because what we see outside is not just what the mind we have. There are deeper layers to it. So we have to start at the gross and move deep within. Working on the mind is where, how do we work on the mind? What are the tools that are available to prepare oneself, even to go towards meditation? We know meditation is an experience, okay? We can teach how one can prepare and go into the state of meditation, but the meditative experience itself is individualistic. So we will help you with the what are the tools available, how to use the tools, and what are the and when we talk about holistic, here again I'm bringing the panchakoshas into the picture because we start with the body level and move into the deeper layers, which is possible only through meditation because the benefits work not just on the body. It just doesn't help lower the heart rate or help you control your blood pressure or bring emotional stability so that you can start working on your blood sugar levels, but it has deeper psychic effects also. So the benefits are multifold. Okay. And as we start practicing and experiencing it only, we will start to know about that. And so what are the tools to work on the different layers of our personality through the meditative practices? Some of the techniques from Bihar School of Yoga, we will be also be teaching you. Antar Mauna is again a very beautiful, very systematic technique. Again, a gift to the world by Swami Satyananda Ji. Starting with Pratyahara and preparing one to move towards Dhyana in different stages. Okay, we will be covering that. Then in the different tools, we all know the power of mantra. So much is being talked about today, in all the different channels and different people have started realizing the effect of mantra. So japa yoga, how to do japa, how to prepare so that you can start doing japa and again progress in the journey of japa also. How do you prepare your body to meditate? Can you sit for 5-10 minutes without disturbance? How do you prepare first to do that? Only if we do that, then we can even start moving inward. So how to work on the physical stability in order to start moving towards the state of mental stability. These are all some of the aspects which we will be covering in detail in this course. So with that, we would like to welcome you all to this. Yeah, just a snapshot. The benefits, we are not talking about that in much detail here. I already mentioned about that. So we would like you all to utilize this opportunity of as Vijay ma'am said, either for healing yourself or for helping out others. So first, we would request that you understand it for yourself and do the practices for yourself, experience it yourself, and then you will be able to share it in a better way with others. Okay. Thank you all. Hari Om.
Hari Om, Ramya ma'am. Yeah, kindly take over.
Thank you.
Hari Om all. Thank you for joining us. So let me share the slides first.
Yes, you can, ma'am.
Yes. Yeah. So are you able to see the slides, sir? Yeah.
Yes, Ramya ji, I can
Yeah.
see.
Thank you. Okay. So this is TTC2. TTC2 is all about women's wellness. So at the end of this webinar or end of a TTC course, you will understand why it's so important that we learn about women's wellness and how are we going to support them. So first, let us look at the stages in the women's life. So women's life is constantly changing, right? From the infant stage, childhood stage, puberty, pregnancy, motherhood, then menstrual cycle phases, and menopause and elderly stage. So each phase, women's life is constantly changing. It is changing through this puberty, menstrual cycle, pregnancy, motherhood, and menopause stages. So, but how often do we actually understand these changes? Do we often spend time to think about what are the changes the body is undergoing and what are the complications and challenges they face? It's a very rare S for this question. So let us see what does play a major role in women's life. It is nothing but the hormones. The role of hormones is very, very important in women's life, not only in women's life, but in men's life also. But why it is so important in women's life, we will be seeing in further slides. So the role of hormones will be, it has helped to regulate our menstrual cycle, reproductive health. It controls metabolism, its energy levels, and influences mood, our emotional well-being. It supports growth, fertility, pregnancy, and maintains our overall body balance. So hormones are the main key factor for our overall well-being. And what is the difference? So men and women both have these hormones, but why it is so important for a woman to have a proper balance in their system? This is a difference. So for women are like moon. So in moon, we have a cycle. We have a new moon and the no moon day. So it is all a fluctuating. So in women's hormone, the hormone keeps fluctuating monthly because of menstrual cycle. So that hormone is very important to maintain the menstrual cycle and fertility. And it influences a strong influence on the mood and emotions. And there are multiple hormones in women's body. For example, estrogen and progesterone. But when we compare it with the men's hormone, they have relatively, it's a stable process there. Mainly, it is regulated by the testosterone and gradual changes over time and less cyclic variation. So women's body definitely need a proper balance. If there is a bit of stress in their body, definitely it is going to affect the endocrine system, and we are not sure which organ or which system it is going to affect. So it is always important to have a balance in women's body. So these, we will be learning about these hormones, the function of these hormones in our TTC course. So, and why do these hormones get disturbed? It's because major factor is chronic stress and emotional imbalance. And because of poor diet. And these days, we all understand that so many processed foods and junk foods and high sugary foods are always in the diet right from the young age, which is in turn giving us a very, very bad lifestyle. Worst health is happening towards this. So right from the childhood, if we don't have a control of this, it is definitely going to affect in the puberty, in their reproductive stages also. And in turn, there is a lack of sleep because of this consumption of this poor diet or emotional imbalance, and sedentary lifestyle is there. And there are so many underlying conditions like PCOD and thyroid issues. So because of these, the hormones get disturbed. And we cannot say like, because only of this factor, hormones get disturbed. There are n number of factors. I have listed only a few factors which will disturb the hormone. Yeah. So if you particularly take only the reproductive system of a woman, this is the HPG axis, hypothalamus, pituitary, and gonadal axis. This you'll be learning in detail. So in hypothalamus, we all understand it's in the brain, and pituitary is the base of the brain, and ovary is the gonads for the female reproductive system. So hypothalamus is the master switch, pituitary is the master gland. So these and ovaries. So initially hypothalamus starts the production of the gonadotropic hormone, gonadotropic releasing hormone. So this goes to the pituitary and it releases the hormones like FSH, which is follicle stimulating hormone, which helps the ovaries to start the production of the follicles. And there is luteinizing hormone, which helps in the release of the ovum from the ovaries. So these functions has to be in balance. So if there is a chronic stress, the cycle may get disturbed. If there is if a metabolism is disturbed, this is going to get disturbed. So hormones play a major role in women's health. So in this HPG axis is so important for a puberty, for your menstrual cycle, and for your reproductive system. So this hormone, we'll be learning about this HPG axis in detail, where we'll know how to regulate it. So if our participants come to you, then we will understand, so where the system is getting disturbed, and we'll be able to address to the point. So let us first deal about the menstrual disorders. Menstruation is a natural monthly process. It happens at every 28 days cycles. 28 to 35 days is a regular cycle. So it happens in that way. It is regulated by the hormones. And menstruation is a major health indicator of a woman's body. Whether you get menstruation, or it is you're getting in a proper cycle, or it is delayed, or it is heavy, or you get only spotting, all these things will help us to understand the health of the women. So we will be in detail, we'll be dealing all these things. So menstruation happens because of the hormonal changes. And if there is a disturbance in this hormone, it is definitely going to disturb the monthly cycle. And there are different phases in this menstruation. Okay. So we'll be learning in detail about this anatomy and the physiology of the cycle. So where is the uterus located, and what are the accessories parts of the uterus, and which is also important. And you will be understanding about this physiology of the menstruation cycle, where you'll understand when they come with a problem, you'll be able to understand and talk to them related to that. So you'll be able to teach your clients also, so where is the problem and how are we going to address it? So hormones play a major role in this cycle, which I've shown in the previous figure. Okay. So what are the common disorders we may see across this? They have a painful periods. So you may see somebody just lying down on the mat on the floor and rolling here and there with a severe pain. It could be because of fibroids, it could be because of endometrial issues, or complete absence of cycles. No periods at all. They will get only for 4 months and complete rest. It could be a symptom for menopause also, but at the young age, they will not have a menopausal symptom. If they're in around 20s or 25s, if they're having this absence of cycle, that's a concern issue. Then some people may come with heavy bleeding. Usually 5 to 7 days will be your cycle. It will be more than 14 days also. So that is also a big concern. And some people may come with PMS, premenstrual syndrome. That is where within a week or 14 days before your period starts, you will have a mood swings, you will have a bloating, irritation, and all kind of symptoms will be addressed to them. Okay. So when they come with this, as a therapist, we will understand, so what is their particular issue? And we will not give a generalized yoga class for them. You will know, okay, for if there is absence of cycles, what are asanas we have to give them, so that it is addressed to the point. It will be customized to them. Once we address to that point, then it is going to definitely help them in multifold ways. And what are the symptoms we'll be seeing that during the periods or during issues they can have a pain and cramps. They can have a bloating issues, mood swings, and fatigue. So these are the common symptoms you can come across when you see the people. And what are the causes for these issues? The major thing is hormonal imbalance. So that's why it is so important for a woman's body to have all the system in balance. Stress is a major factor, and poor diet and lifestyle. So these are the causes, some of the causes which disturbs your hormones, which disturbs your menstrual cycle. So when we have a yogic approach, the holistic approach, not only dealing only with asanas. When we're going to deal with asanas, we're going to give them pranayama, breathing practices, we're going to give them lifestyle changes, and we're going to take what kind of relaxation methods, tools, which we think ma'am was talking previous session. So those kind of relaxation, if we are going to give them, it is definitely going to help them a lot. So we will understand how to address to the point. So why do we have to really address this? It's a menstruation cycle. It's a normal one. Every month they get, it's a natural process. But why you have to, what kind of impact it gives if it is not going regularly and properly? It affects your routine, and it causes emotional stress and always reduces the productivity. And this plays a major role in the reproductive system also. Okay. So this is all about menstrual disorders. So in menstrual disorders, we'll be dealing with what kind of disorders they're coming and what kind of yogic approach you can give to them. and in detail about the anatomy and the physiology of the menstrual process. So next will be about thyroid. So thyroid is yet another, is an endocrine gland, which is also very, very important because it plays a major role in your reproduction, in metabolism, in many other functions. This is a very, very important gland in the body. That too, in women body, if it is get affected, it is going to it is going to reflect in the reproductive system. If they have a thyroid in the during the conception process, like chances are very less for them to get conception. Okay. So thyroid is a endocrine gland. It controls the metabolism and it affects the whole body if it is not properly maintained, if it is not in the balance. So we'll be learning that about the anatomy of the thyroid gland. The thyroid gland is a small butterfly-shaped gland which is located in the front of the neck, and there are 2 lobes in the thyroid gland. And we'll know about the follicles and what are the hormones thyroid gland is secreted, and who is going to make the switch for the thyroid gland to activate these hormones. So the functions of this thyroid gland, on a few functions I have listed here. There are n number of functions for thyroid gland. Mainly is metabolism. It maintains the heart rate. It maintains the temperature in the body. So in women's life particularly, where all thyroid gland plays a major role during puberty. If thyroid gland is not working properly, it's not in balance, they may get either delayed puberty. After 17, 18 years, they may get, or they may not get at all, or very early puberty. Around 8 or 9, 10 years itself, they may get the puberty. And in menstruation. So this is in turn also affects your menstrual cycles. Either you have a overflow or very scanty flow that can happen because of imbalance in the thyroid. And in reproduction, ovulation doesn't happen at all. So it will be very hard for a woman to get conception. And in pregnancy, during pregnancy, if we are diagnosed with a thyroid disorder, doctor will definitely give you a pill because it is important for the baby's brain development. So in that way, thyroid is playing a major role. In postpartum, it again goes into mood swings or fluctuation, irritation. Those kind of functions will happen because of imbalance in thyroid. And menopause, the early onset of menopause can happen because the thyroid is in imbalance. So now we'll understand why this thyroid gland is so important in women's life, because we pass through so many stages in their life with challenges. So this has to be maintained in balance. So when there is an issue with them, so we'll give a yogic approach. See that all the koshas, Annamaya, Pranamaya, Manomaya koshas, we'll address each thing. So we'll be giving them yogic asanas customized to this, and breathing and relaxation practices. So and there are 2 types of thyroid. The major one, there are a few others also because of autoimmunity. So the major issues will be hypothyroid and hyperthyroid. And there are differences. Few asanas we shouldn't give for hyper, few asanas we shouldn't give for hypo. So we will be learn as a therapist, we will know more about the contraindications and what not to give them. Rather than what to give them, we'll focus more on what not to give them so that it'll address their issues. And because of thyroid, what kind of symptoms we may have? Weight changes will be there. If you have a hyperthyroid, that is overactive of the thyroid gland, then weight changes will be there. Weight changes will become very thin. And if it is hypothyroid, they'll have put on so much weight. You'll have only this much of food, only a little amount of food, even though the weight will be so much, because thyroid is affecting the metabolism. If metabolism affected, definitely you look fat. Then you may have fatigue or anxiety. Again, if it is an overactive thyroid, you'll have anxiety issues. If it is underactive, you may feel more fatigue and you'll be always feeling sleepy. And there is a temperature sensitivity. If you have a hypothyroid, then even a little bit of decrease in the temperature, you will feel more of shivering and more coldness you will feel. These are only the few symptoms. There are so many symptoms in this. And what are the causes for this thyroid imbalance? Again, stress. Autoimmune condition can lead to thyroid disorder, and our lifestyle changes. Using more of non-stick vessels, using your makeup items is also will lead to thyroid issues. Even using the nail polish, which has some factor which is disturbing your endocrine system, that is also will affect your thyroid issues. Okay. So what kind of impact you will get? Definitely you're going to have a low energy. Mood changes will be there, either very low mood, you'll always feel sleepy, you will feel like a brain fog condition, or you'll become very anxious. And there is definitely a cycle issue, monthly cycle. There will be issue with this monthly cycle. So what kind of yogic approach we are going to teach here is it's going to be a holistic approach. So not only you're not to give it a generalized asanas, you will particularly figure out whether they're into hypothyroid and hyperthyroid. And according to that, you will customize their asana practice, and you will be giving more of breathing practices, relaxation, ajapa japa, yoga nidra, meditation, and these all will give us balance. The balance, how are we going to see things which they're focusing on? So everything is going to help us to handle their thyroid. And always remember, this is going to be a complementary therapy. If your participant is taking a thyroid medicine, you shouldn't ask them to stop it and then come to yoga class. So it has to be added on, complementary thing. So relaxation is going to help them to have a deep rest. It is going to improve their sleep pattern, and it's going to calm them. So when all these koshas are taken care, definitely the body will return into balance. Then there are higher chances that they may come out of this thyroid disorder. So you will be advising about the lifestyle changes and how they have to control their stress, and setting up a proper routine so that they can come out of their all these disorders. And for thyroid, we will be giving you the diet also. Here, how balanced your food should be, what kind of food you shouldn't take, like mostly of goitrogenic foods, and iodine support, how much you have to take, and reducing junk. These kind of diet advices we'll be giving them. Okay. Yeah. So this is all about your menstrual disorders and thyroid. So we'll be at the end of the TTC2, you will understand why women's wellness is so important in today's life, and what kind of issues they may come up, and what kind of yogic approach you can give them. So that you will be on contraindications, what you shouldn't give. These things will be taken care in this TTC2. So let's spread positivity and support each other in achieving this swasthya. And thank you.
Thank you.
Hari Om. Hari Om, everyone. Can you all hear me?
Hari Om ji. Hari Om.
Sure, ma'am.
Hari Om. Again, welcome you all to this webinar focused on women's health. This section of the webinar where we are going to focus on women's health. Ramya ji already explained the various life stages and what is going on within the body of a woman during these various stages. So we will focus on the puberty and then from there forward. As you all know, puberty, there's so much of rapid changes that the girl starts to going through. Physiological, psychological also. There is so much happening in the body, in the mind. And now every other child is having some kind of an issue. And menstrual problem is one, which she already went through in detail. So a lot of support, both physically, mentally, emotionally is required for the child at that age. And from then on, there's a lot of responsibility from a family as a whole to, to nurture the child and to have to blossom into a healthy woman. So the most important or the starting problem from there may be the PCOS. Do you hear this word very often? Maybe PCOD also, right? People use this interchangeably, PCOS and PCOD. PCOD is polycystin ovarian disease or disorder, but PCOS is actually a heterogeneous disorder, which means that it is an umbrella of so many things, many issues coming under the umbrella of due to the excess androgen production in the ovaries. That interferes with the reproductive, endocrine, and metabolic functions. Typically, this happens before women, happening between the age of 15 to 44. Basically, it's during the childbearing age. But actually, many people, 70% of them, don't know that they have PCOS. They think it is just skip period. They think it is a scanty period like that. But actually, until the time when you're married and I think you're ready to have the baby, that's when they identify why the cycle is not there, and then fertilization does not happen. And do you all know how many fertilization centers, these kind of hospitals, artificial, getting pregnant in many other ways? Those are all now springing up in every nook and corner because of the capability of the person, of the woman, not being able to bear the child. And a very important reason is because of the PCOS condition. So basically, the hormones play a very critical role. The estrogen, the progesterone, the FSH, the LH, right? These hormones play a very important role. Androgens, when there's excess, this condition is actually caused. So basically, in PCOS, there are like small sac. So a sac is fluid filled. And because of that, there are multiple. Poly means multiple. So polycyst is many cysts are formed. And these follicles actually contain the immature egg. The eggs never mature because the lack of ovulation happens because of the altered changes in the estrogen, progesterone, androgen, FSH, and LH levels. Because of this, the fertilization does not happen. What actually causes it? We can't nail down into one reason. There could be many reasons, and science is still finding out what is the core reason, but then it could be genes, it could be hereditary in the family. The most common one is the insulin resistance. We all hear about this insulin resistance, which is the cause for many other diseases, and PCOS in women is most common. Obesity, or if they already have, other issues, hormonal imbalances, and these also cause obesity. Insulin resistance also may cause other the downstream effect on it is also like type 2 diabetes, etc. Even inflammation also can cause PCOS. So typically, there are many common symptoms where you can already identify whether they have PCOS. Either they have missed period or no period for consecutive many months. If you know, when we actually, in yoga therapy, the most important aspect is to diagnose the problem correctly. So on the first diagnosis itself, when you listen to the history, then you will know that this person is going through a condition where it's amenorrhea, which is like the absence of periods for a consecutive of 3 months, or having periods within different cycles after 35 days, etc. Typically, it's about 28 days. So those symptoms also tell us that this is a condition. And with multiple other conditions physically, like hair growth, some women develop hair on their face, typically, which is the category or a characterization of a male. They even develop, male pattern baldness, heavy hair loss, acne, weight gain, darkening of the neck. There are so many physical symptoms where you can already tell, why you can easily diagnose that this person is going through the PCOS condition. Why? If periods is not there, what is the problem, you may ask? There are so many downstream impact. Infertility is the most one, because as a woman, the very important milestone is to have a childbearing is a very important milestone. And then the joy of having a child henceforth is also being taken away because of the infertility and the treatments for that. Metabolic syndrome, which is actually, the other risks of blood sugar, high blood pressure, all this also happens. Sleep apnea is another condition which is dangerous. Most importantly, endometrial cancer. All these are, when PCOS is not addressed, these all can, lead us to there. So it's very important to identify and manage this condition. Psychologically, also the women go through a lot of depression, especially if you're not able to have a child, mood changes, mood swings, irritability, lack of any drive. These are such changes that the person goes through. So PCOS is, you hear every other person. It's become so common. Every other person that, a friend when you talk to, a family member, this becomes very, very difficult. So even if they're able to get pregnant, right, with treatment, even during pregnancy, there are so many risks. The risks are much higher for a person who has had PCOS and conceived than the other person who has conceived the other way. So even during pregnancy, having a case of abortion, or even having gestational diabetes, having a premature delivery, there are so many risks that the person carries when you have PCOS. So we'll be learning. So how can we manage this condition? How can we get the hormones regularized and to have a natural pregnancy and the health maintained? So moving on to the next condition after PCOS, where the childbearing age is finished, is menopause. And I'm sure we all have a family member who's going through this also. This is when happens in a woman's life, where there are 12 consecutive months where the menstrual period is absent. Typically, it used to be around 50 plus, 51, 52. But now it's like, its onset is very, very high. You see people, going through menopause at very, very young age, which is very sad. And the impact on the body is very high as well. So it's actually a natural process where the ovaries stop producing the hormones. But this happens very early, and it will have its own damage done to the body, the organs as well. There are actually 3 stages. It happens as perimenopause, menopause, and postmenopause. Perimenopause actually begins much earlier and can last from 40s, they can start having it, and then coming to the actual menopause, where they don't have the menstrual cycle anymore. They don't have the ovaries, don't release eggs, and the body doesn't produce estrogen. This can happen at about 12, minimum at least 12 months of lack of menstruation is called menopause. Then the postmenopause happens, where from then on to the rest of the life, where there is an increased risk of osteoporosis because of the lower estrogen levels. So the woman may be going through various symptoms, of course, irregular period is one, hot flashes. This is like suddenly feeling warmth spreading all over the body, night sweats, vaginal discharges, dryness, difficulty in sleeping, emotional changes, and tenderness in the body, raising heart rate. You don't even know why this is happening. Is it menopause or is it some other condition? Headaches. I'm sure you would have heard this saying, this, your mother or aunt or somebody is going through this. But previously nobody even complained about it. And now this is like totally identified, and to manage them is more important. Give them the physical and mental strength, how to manage this through the yogic management, not through medicines. If you are under medication, if you are under a consultation of a gynecologist, which is well and good for a guided experience. So we are here to learn how to support on a yogic management of this condition. The next condition that we're going to see is about uterus prolapse. This is a condition where the pelvic organs are the pelvic floor, the group of muscles, right, in the pelvic floor, which is like a hammock, which is actually bearing all your pelvic organs. When these muscles and tissues surrounding these pelvic organs become weak, the elasticity is lost, then what happens? These organs like the bladder, the uterus, vagina, small bowel, rectum, these are the pelvic floor organs. Because of this weakening, the uterus prolapse happens. So the disorders include pelvic organ prolapse, also urinary incontinence, and also anal incontinence. Very, very inconvenient and a very embarrassing situation for elderly women. So it's very important. Some people even don't tell about it. It's very embarrassing to tell about this condition, and they struggle internally going through this condition. So usually happens in elderly women and happens in 4 stages typically, where the uterus, which is the upper part of the vagina, it happens, it gets moved down to the opening of the vagina. And then the stage 3, where it even bulges out of the vagina, and the stage 4, where the uterus is completely out of the vagina. So it's a very difficult and very discomfort period for the woman. So symptoms typically include sensation of heaviness or pulling in the pelvis. You will feel that something is protruding out of the vagina, and urinary problems, urinary leakages, bowel movements. All this may have lots of discomfort during the uterine prolapse stage. The main causes actually is believed to be pregnancy, but even women who have not conceived can also have this, or a difficult labor or a delivery trauma during a childbirth. Obesity, of course, is a root cause for many issues. Lower estrogen levels after menopause, and even any heavy lifting that they've done, any occupation or anything that they've done part of their daily lifestyle, can also cause uterine prolapse. So what are the risk factors? There are so many risk factors that the women have to go through. It can increase your risk for any surgery, any chronic constipation, etc. So identifying it and avoiding the complications is very, very important. Prevention. So all the yogic lifestyle is all about prevention. How do you do the asanas, the practices that you can do to prevent uterus prolapse will also be taught. And how you can manage the hormonal levels that will also be taught as part of the entire program. So these are the conditions from puberty to the menopause to the uterine prolapse that the woman will be going through, and then we want to focus on the areas where they are struggling through various practices. And it is not one stop, it is not one solution, just asana or just pranayama. A holistic approach using asanas, physical practices, kriyas, cleansing practices, pranayama, the breathing practices, conscious breathing, bandhas, mudras, along with lifestyle changes, healthy dietary habits, the relationship with food, the understanding of the nourishment and the damage that the food can bring to you. And of course, with meditation practices, along with spirituality, a wholesome solution, wholesome management of women's health. You will be learning and helping. So as a yoga therapist, you will be equipped to learn with techniques and tools to help women who are going through this, who are already going through this, to manage, and in a preventive manner to avoid future problems for people who are nearing this specific ages as well. So with this, I would like to conclude. Hari Om, and we welcome you all to be part of this learning and healing for yourself, your family members, or the others that you may who may reach out to you for yoga therapy. Hari Om, Vanisha ji.
Thank you. Hari Om ji. Thank you, ji.
Hari Om. Hari Om, Hari Om all. So what we have to understand is all these courses like TTC1 and 2, you cannot take both at a time. Few people used to ask, can I take both 1 and 2? 1 itself is difficult, 2 is separate. That's also difficult. So both are very challenging. So we request if any of you want to join, you can contact our coordinator, Vanishi ma'am, and get the further details. It will happen only on Sundays for the TTC1 morning 8 to 12:30, and for TTC2 it happens between afternoon 2 and 6:30. So when we see all these diseases, these are all called psychosomatic diseases. That means these are the diseases caused to the body by mind. So we should understand more on it. When you address the mind, the ailment is addressed. That's why Yoga Nidra, meditation, all those things are the allied subjects. Any questions so far, whatever about the course or anything? Do you have any question? So if you want our coordinators to reach you, you can put your phone number in the message. We will contact you.
Do we get teaching material for this courses, sir?
So the materials we'll be giving, ma'am. The ashram will be giving the material.
Okay.
Intentionally, the materials are given just 2 weeks before the exam. Once the live class is over, we'll be giving you the class recordings, which will be available for a week. So you are supposed to listen to the recording and write the notes, because that will help a lot to gain insight about what we are teaching. Of course, the ashram material will be giving just 2 or 3 weeks before the exam so that you can go through it. This is a rule we are following for a long time. And the attendance is compulsory. 100% you need to maintain attendance. Only one absence is allowed, one class absence. If you make a second absence, then it'll be very difficult. Then it's not advisable to do that. There are certain things we follow so that it happens smoothly. You also gain the right knowledge. Yes.
Do we get the recordings of the sessions?
We'll share through the Google Drive, ma'am. We will store it and share the Google Drive to all the participants.
And exams will be like objective type or written.
Yeah. There is a viva after every subject is over. And in the end, you will get objective type exam, and you also get a long answers where like 10 numbers, 10 marks you need to write for 2.5 hours, around 15, 20 pages. That's also there.
Okay. Thank you, sir.
Thank you, ma'am. Any more questions? Okay. Thank you all. Vanishi, ma'am, anything else to say? Okay. Thank you also. Please make use of it. And if anybody interested, please call us. Thank you. Hari Om. Namaskar.
Thank you. Hari Om all. I have posted my contact number in the chat box. Please do contact me. Few has already enrolled. Aradhana ji and Padmini ji has enrolled already. Remaining all, I have posted my contact number in the chat box. Please note down my number and please do contact me for the registration and further queries. Please note down my number, which is in the chat box. That's my WhatsApp number also. So you can ask your doubts through WhatsApp also. Sir.
Okay. Thank you, ma'am. Thank you all. Hari Om. We'll meet you the next time.
Thank you all. Hari Om. Thank you.
Thank you, sir.